Hi, my name is Dr. Rob DeBeese, and I wanted to welcome you here today to another one of Dr. Rob's Whiteboard Sessions. Today, we're going to be talking about subclinical hypothyroidism and its relationship to weight gain. But before we do that, you have to have a little bit of understanding of the different hormones that affect the thyroid or that the thyroid makes, as well as what those hormones do in the body and how we look at them. So first off, in the brain, we have a gland called the pituitary gland. And the pituitary gland makes a hormone called thyroid stimulating hormone. And this hormone, its purpose is to stimulate the thyroid gland to make its hormones. Now, most people heard of T3 or T4, but don't realize your thyroid actually makes T0, T1, T2, T3, T4, and calcitonin. The other thing that's sometimes confusing to people is someone says, my TSH was high, but my doctor wants to put me on Synthroid or levothyroxine. Why is that? Well, let's take a look. When your TSH goes high, what that means is the pituitary gland is yelling at your thyroid. Let me explain. For those of you that have kids, you ever tell your kid to clean up his room? And they always do it on the first time, right? If only life was so easy. Typically, the way that works is this. You ask your son or daughter, hey guys, I need you to clean up your room. We have guests coming over tonight. They go, okay. You walk by the room 10 minutes later, still not cleaned. Hey guys, I told you you need to clean up the room. Make sure you get that done. 15, 20 minutes later, room is still not clean. This can go on a couple times. Usually the fourth or fifth time that you're asking your child to clean their room, you're not asking anymore. You're at a whole nother decibel level that only usually the canine species could hear, right? You're yelling, you're screaming, clean up the room. This is the last time I'm going to tell you. Well, your thyroid works the same way. Your your pituitary tells your thyroid to make thyroid hormone. And once that thyroid hormone enters the blood, the pituitary gland senses that. It picks it up and it goes, oh, great, the thyroid listened and made the thyroid hormone. Well, when the thyroid is in a hypoactive or underactive state, what typically happens is the pituitary gland tells the thyroid to make thyroid hormone, but the thyroid is too weak, deficient, toxic, virally infected, whatever. It's messed up and it can't make the right amount of hormone. As a result, the pituitary gland goes, why isn't the thyroid making the hormone? It's looking in the blood for the hormone, and it goes, there's no thyroid hormone. Much like the parent walking by the kid's room and go, why isn't the room clean? You should have cleaned it. Well, the pituitary has to start yelling at the thyroid, and the way it does that is it wants to stimulate it more. So the TSH starts to go up. So the more TSH that's made, it means the more the pituitary has to stimulate this thyroid gland. But the problem is not everybody has elevated TSH. There's a lot of patients that I've seen over the last 18 years where they come to me with these full-blown thyroid symptoms, but their TSH is within the quote-unquote normal range. Well, what I found over the last 18 years in practice is the normal range is not actually the normal range. What I found is this. If your TSH is above 2.9 and you have hypothyroid symptoms, cold hands, cold feet, losing your hair, loss of the outer 1/4 of your eyebrow, cravings for carbohydrate, can't lose weight, fatigued, all these different things. If you have these problems and your TSH is above 2.9, chances are there's something going on with your thyroid gland or the ability of that thyroid hormone to work properly in the body. And there are different holistic labs that I use in my clinic to help identify exactly what's wrong with that thyroid so we know the correct nutritional program, supplementation program, bioidentical hormone program, whatever it is to get the person on so that way their body could heal, their hormone levels could return to normal, and they could lose weight and start to feel well again. So basically then, if you have those hypothyroid symptoms, which I'm going to list out here with some pictures for you in a second, but if you have those hypothyroid symptoms and your TSH is above 2.9, it's time to do some alternative testing so we can evaluate exactly what's going on as far as the underlying cause to these thyroid symptoms. The thyroid hormone is key in helping the body burn fat, which is why you'll have some people with thyroid problems. And man, they're exercising their butt off. They are dieting their butt off, doing all the right things, but they're still not losing the weight and they're not seeing the results that they want to. And that's when it's time to step in and look for this subclinical hypothyroidism. So I hope that was beneficial. I hope that helped you. I'll see you guys all at the next Dr. Rob's whiteboard session, where we're going to discuss the liver's relationship to activating your thyroid hormone. So some people with toxic livers are really the cause of their thyroid problems. I hope that helped. Have a great one. Bye.